So anamnesis is recollecting of the past events, the entire case history of the patient, which takes into consideration the present as well as the past. Now what is the purpose of anamnesis? The purpose of anamnesis, the first and the most important aspect is to individualize the patient. That's why we take the case. We don't take the case. None of us are interested in what is happening in your life or my life and everything, because all of us have got a lot of other things to do. But as a homeopath, we are interested to know exactly what is wrong with you. What is the disease aspect inside you that I need to consider, I need to cure inside you. That will happen only by the process of individualization. So the first and the most important aspect of anamnesis is individualization. How you individualize it? We find out what is the peculiarity in you. We start dividing what is common, what is characteristic. The next is to find out the similibum. By doing this further in the anamnesis, it helps us to understand the susceptibility of the person. How has the disease progressed? What has been the past? Whether in the past the person has reacted properly to his illnesses or not. Whether he has been able to recover from his problems or not. Like for example, if I understand in a case that the child had say bilateral pneumonitis as a young infant, he is growing, and since that time the child has developed recurrent infections, and every third or second recurrent infection gives rise to lower respiratory tract involvement. So I know when the child comes to me at the present moment, when he is about say 15 years old, 16 years old, that time I understand correctly that because the past susceptibility of the child is not good, because he is being falling prey, because his immunity aspects are not strong enough to curtail the infection at the superficial level, this illness, whatever is going to have now, is also has a greater chance of going deep. He has a greater chance of developing more complications. So my management, my way of looking at the child, my remedy, all these things will change, because my assessment of child susceptibility at this moment is different. Because I know the past history of the child, I know how this child has been behaving in the past, how his illness has been coming up, what complications he's been getting. So I know that. Like for example, mother comes and gives you the history that when he developed measles as a child, he developed bronchopneumonia immediately after measles. So you know that the susceptibility of the child at the time when he had measles was not good. That's why he developed bronchopneumonia. So now again, if he develops any acute infections, I know that his chances of going into a complications are much more higher. So by that, now if we just take a look into the present features and we miss out the past, we won't be able to gauge the depth of the disease, we won't be able to know what exactly is going to happen to the child. So obviously our management will not go to that depth what we need to do. The next part again important by anamnesis is the miasm. Now I don't know whether you people believe in the concept of miasm or not. There are many different views, different approaches. Everybody talks about miasm in their own way, their own understanding. Okay, but it's not the time today to discuss about miasm, but what exactly you look in the anamnesis of miasm, again it tells you about the prognosis of the case. Okay, like for example, if I get 2 children with fever, okay, now what I have seen in children's cases that children with a strong tubercular parentage or past history of tubercular miasm or a strong tubercular miasmatic background have got more chances to develop febrile convulsions and complications with simple plain fevers. While on the other hand, if the child is purely soric or psychotic to some extent, then the chances of developing any complications with acute fevers are much less. So obviously in this case of a tubercular miasm child, my management will be much more aggressive. I will be much more alert when I am dealing with any acute infections or acute things with the child, because I know he is a strong tubercular parentage. He can go into complications much faster than a simple soric child, where I know it's an infection, it's an acute disease, you give medicine, you don't give medicine, it will go off in 3 days without any complications left behind. Are you getting this? So by this way, understanding the whole anamnesis, getting into the whole detail of the case with the past history, with the present history, I will be able to make a proper line of management for the patient. If I miss that out, and I'm just treating it without understanding the anamnesis, I'm going to create complications for the child. Anamnesis also will help us to make appropriate examinations and investigations in the child, or in any case. It also helps us to reach a correct diagnosis, form a differential diagnosis, what we need to do, what we don't need to do, what is the diagnosis, whether we need to send for such investigations or not. Suppose past में अभी a few days back I had a case of lady, say about a 20 or 25-year-old lady with chronic renal failure. She is about to enter into a phase of chronic renal failure. Creatinine is 2.9, and in the past she had abdominal tuberculosis. Now, when she had abdominal tuberculosis about 7 years back, she was admitted in the municipal hospital, and they did a battery of investigations to her. They gave her anti-cox medicine. She was not responding to the anti-cox medicine. She was diagnosed as tuberculosis on biopsy also, but they found a lot of antibody levels were very high in her case, and she had some rashes developing in the body. Now, when these antibody levels were high, they diagnosed her of having polyarthritis nodosa with abdominal tuberculosis. Now, these physicians, I don't know whether they understand, or she was being treated by some interns or someone in the hospital, that tuberculosis per se is an illness which gives rise to a lot of false positive antibodies. Now, poor this girl, apart from AKT, was given a lot of cytotoxic drugs to take care of the polyarthritis nodosa part. She took steroids high doses for 4 years plus cyclophosphamide for 4 years, which gave rise to a renal failure. And later on, when they did her blood test, all her antibody levels were negative once the tuberculosis got cured. Now, what exactly are you dealing with today? If you don't understand the past, whether you need to send the patient for investigations again because each investigation of these antibodies is going to cost her thousands and thousands of rupees. Now, whether you really need to send the patient for it, or whether you just need to manage the kidney part of it, because now what you're dealing is more of an iatrogenic disease which is caused by the drugs, which is very, very difficult even by a correct remedy to get cured completely. At the moment, what you can do is just palliate the patient and pray that the illness doesn't progress much more further. Take care of infections and all those aspects, because each infection will create more problems for our kidneys. So that's the way you need to deal with it. But if you don't understand that how the whole illness is developed, what is it, your scope, whether what you have a scope in this case or not, whether you have limited scope in this case, all these things will be decided by your anamnesis. So it is not just the present, you are taking into account the whole evolution of the case. To find out the causative factors, to find out the tendencies, another important aspect, what kind of tendency, what kind of diathesis, what kind of dyscrasia this patient is having. All these things you will come to know only with the help of your anamnesis. To establish a context of a child's illness or problems in terms of themselves and their family, so that optimal and pragmatically useful treatment plan tailored to their needs and understandings can be arrived. This is very important. This is your dealings with the patient. Apart from your medicine, this is what we need to do. Every individual has got its own tailor-made line of management. You can't decide that I treated one case of tuberculosis this way, the next case that comes to me also will be dealt in this way. No. It all depends on the patient's social, economic data. Like for example, if a patient of tuberculosis comes to you with a higher middle class or a higher class social status, then obviously you can advise lot of vitamins, lot of supplements, lot of good diet and everything. But if the patient comes to you with from a lower socio-economic class, where you know that in the past also any illness they have to rush to a municipal hospital to get free medicines and all those things, then obviously your